Mind, do you? To be all over YouTube.
Who's that handsome guy?
Potential employer. Be watching this. Hopefully it'll distract from me.
Okay.
May it please the court, ladies and gentlemen of the jury, good evening. My name is Eli Federman and I represent the plaintiff, Mr. Infante. What I say at this time is an indication of what we will prove in this case. We have reviewed the records, taken statements and depositions from all who were concerned with the case, have talked to consulting doctors, have hired experts who are specialists in the field, and have reviewed the photographs so that we know the case very thoroughly and can tell you what the evidence will prove. You will meet my client, Mr. Infante. He is a hard-working 88-year-old retired mailman. In May of 1990, Mr. Infante's left limb below the knee was amputated as a result of a badly infected diabetic ulcer that was exacerbated by poor treatment. Mr. Infante is now permanently disabled and disfigured. He did not have to lose his leg. Mr. Infante's amputation could have been preventable if his doctor, Dr. Brenner, had exercised ordinary and reasonable care in treating Mr. Infante. Mr. Infante is one of 23.6 million people in the U.S. who suffer from diabetes. Diabetes is a condition caused by a pancreas malfunction. Out of the 23 million, according to the American Diabetics Association and CDC, 60,000 or so people require a lower extremity amputation. Treating a foot wound through early detection and proper follow-up will diminish the risk of having an amputation by up to 85%, according to the International Diabetes Federation.
Objection.
What's the basis of your objection?
The proof of that is not in the record.
Well,
He has to prove it.
well, we agree he has
It's
to prove it.
medical
We're at opening.
It's
What
Your
proof are
Honor,
you
we
gonna
plan
prove?
on introducing an expert witness who will testify to the International Diabetes Federation statistics.
Well,
Findings.
I don't know whether he'll testify to the statistics. He might, but since he's going to produce this through expert proof, I'm sure if he comes up short, you'll remind everybody of it in summation. Right, counsel?
Yes, sir.
Go ahead.
Thank you. When an ulcer is treated properly, the chances of an amputation are significantly reduced. In the present case, the most disheartening fact is that with good and accepted medical care, this amputation could have been prevented. Dr. Brenner, you will learn, is a specialist and has been for a number of years practicing in podiatry. Under the law, Dr. Brenner is held to the standards of a specialist and must perform and act in accordance with the legal requirements of his specialization. Dr. Brenner began treating Mr. Infante in December 1986. Although Mr. Infante was treated previously by Brenner's father, they worked together as father and son, and Dr. Brenner, the defendant, continued treating Mr. Infante for his ulcer until March 1990. A diabetic foot ulcer is a wound on the foot that you or I would be able to feel, but because of Mr. Infante's condition, he could not feel sensation on his foot. Mr. Infante needed to seek professional care of a podiatrist to monitor and treat such a condition. Ladies and gentlemen of the jury, Mr. Infante's amputation was preventable if Dr. Brenner exercised ordinary and reasonable care. What I want you to look at is how Dr. Brenner was negligent in failing to examine Mr. Infante's prior podiatric and medical records, in failing to recognize the significance of physical findings such as a 9mm deep wound caused by the diabetic ulcer, in failing to refer Mr. Infante to a vascular surgeon for further diagnostic evaluation and or medical treatment, even when the ulcer wound was 9mm deep, for failing to timely and accurately formulate a diagnosis of Mr. Infante's condition, for failing to prepare, keep, and maintain appropriate and thorough podiatric records, for failing to advise Mr. Infante to offload and continue to debride the diabetic ulcer and drain when Mr. Infante should have been hospitalized, and lastly, for failing to communicate with the other physicians regarding the treatment of Mr. Infante, treatment that Mr. Infante had to seek on his own because of Dr. Brenner's failure to refer him to outside help. These, ladies and gentlemen of the jury, were all departures from good and accepted podiatric practices. The defendant in this case may argue that Mr. Infante was non-compliant with Dr. Brenner's recommendations to stay off his foot, and that is what led to the amputation, basically blaming the victim. But Dr. Brenner testified in his deposition that he knew early on about Mr. Infante walking on his foot. Assuming this to be true, Dr. Brenner then had a greater duty to refer Mr. Infante to a vascular surgeon because he was aware of the fact that Mr. Infante may have not been following all of his advice. This is a greater reason why Mr. Infante needed good and appropriate medical care. The fact that Mr. Infante was non-compliant, ladies and gentlemen of the jury, is no more a defense than would a patient's smoking habits be in a case against a radiologist for failing to detect lung cancer on a chest x-ray, just as Dr. Brenner here failed to detect the severity of Mr. Infante's ulcer. It is also clear from the record that Mr. Infante kept up with his appointments, giving Dr. Brenner multiple opportunities to recognize his deteriorating condition and at least refer him to a vascular surgeon. Dr. Brenner neglected the ulcer and failed to refer Mr. Infante to a vascular surgeon, all clear departures from good and accepted medical practices and ultimately culminating in the amputation of Mr. Infante's limb. You will learn that proper treatment of Mr. Infante's ulcer was within the province of Dr. Brenner's expertise, and that had ordinary techniques been followed, Mr. Infante's limb could have been salvageable. Thank you.